on Health, a show on all matters health, wellness, and lifestyle. I am your host, Joy Bofenda, and on this episode, we discuss dental hygiene alongside Dr. Mitch Dotel of Equity Afia Juja. But before we head over to the conversation, take a look at the health update. So maybe Daktari, introduce yourself to our audience.
Thank you very much. Well, my name is Dr. Mitch Dotel. I am a resident dental surgeon here at UKTV Juja branch, and I'm so happy to be here. Thanks for having me.
Okay, so maybe we can just start straight to the conversation of the day. What is dental hygiene?
Well, dental hygiene refers to the practice of making the mouth clean and free from disease.
Yeah. So what are some of the good common dental practices?
Okay, so when it comes to good oral hygiene practices, we are talking about first of all maintaining a good oral hygiene. That is by brushing your mouth, your teeth, two times in a day. This one helps to just reduce the amount of plaque and dirt in your mouth, and also just reduce the amount of bacteria, because normally in the mouth there are a lot of species of bacteria. So once you brush your teeth twice a day, then you reduce the amount of bacteria in your teeth and you make your mouth healthier. That is number one. Number two, we also talk about something we call dental flossing. This one refers to using kind of a strip. It looks like a strip, yeah? So you pass it in between your teeth to clean the spaces in between your teeth, because you see, you can imagine once you brush your teeth, there are areas that are not self-cleansing, yeah, so you need to get rid of this debris of food that actually pack in between teeth. That is why we emphasize on the importance of flossing. And then also regular dental checkups to the dentist. I know people are always like, I only go to the dentist when I am so sick, when I have a painful tooth. But ideally, it is good to go see a dentist just for routine checkups. You never know. Something might be developing and then later you realize when it's worse. So it's good to always come so that we do the routine checkup, we clean your mouth, and we advise on any issues that might be coming up in your mouth. And also just avoid smoking, and also check on proper diet. That would be good. Yes.
And what are some of the common poor practices other than smoking, of course?
So poor practices, of course, it's just the vice versa. If you do not brush your teeth, then you're at risk of causing disease in your mouth, yeah? If you don't brush your teeth properly and twice a day, if you don't floss, if you smoke, as you've mentioned already, and also checking on diet. If you're a person who likes snacking on sugary food and you don't clean your mouth, of course, the action of bacteria and the sugary foods will lead to holes in your teeth and also lead to inflammation of the gums.
Okay, so you've also mentioned routine checkups. Most people don't know the meaning of routine. In a year, how much time would you recommend at the dentist?
Ideally, for dental checkups, twice a year is good. Yeah, whether you're having issues or no issues, just twice a year, so that everything is checked, so that you can confirm that all is well. Yes, 2 times.
And also you've mentioned oral diseases. Is poor dental hygiene only linked to the mouth, or does it also affect other parts of the body?
Really, when we have a problem in your mouth, normally, there is a correlation, either directly or indirectly, between poor oral hygiene and your overall health. Because you can imagine, just number one, the most obvious, if your mouth is unhealthy, yeah, you're having gums that are bleeding, you're having cavities, the very first thing that will be affected is your mental health, because you'll be in pain. Already your mental health will not be okay. So that is the very first thing. The other thing, there is an indirect relationship between oral diseases and cardiovascular diseases. This is because once you do not maintain a good oral hygiene, you find that the gums become inflamed, yeah? So when the gums are inflamed, they they become red and swollen. So the vessels within the gums, they harden, the walls of the vessels harden, which we call atherosclerosis, yeah? And hardening of these vessels, you can imagine the mouth and the heart here. So when these vessels harden, then if it causes atherosclerosis, it even prevents the proper flow of blood into the heart and to the entire body, yeah? That is cardiovascular diseases, yeah? We can also talk about respiratory diseases. It's linked, though not directly, but if you're having inflamed gums and a dirty and unhealthy mouth, yeah, the amount of bacteria increase. And research has shown that actually, when the amount of bacteria reduces in your mouth, you are at a risk of inhaling. Once you inhale, then research shows that it leads to a possibility of causing pneumonia. Yeah, yes. It is linked to other body parts, yes. So, and then also just a healthy mouth, a healthy body. So you can imagine the mouth is a part of our entire body, yeah. So if you do not take care of the mouth, then it means the entire body is also at a very high risk.
Okay. Yes. There's also this perception, and especially on TikTok, Instagram, that most practices, especially the root canal, is linked to breast cancer. Yes. Could you confirm that kindly?
Well, all I can say is that root canal does not cause breast cancer in any way, because, well, all the materials we use at the dental clinic are very biocompatible. This means that all this material, they do not have any toxic effects to the body. Yes, so it cannot lead to cancer.
Yes. And what about practices such as, okay, when we were younger, we used to remove bottle corks using our teeth. They used to say that it made our teeth stronger. Is this true?
Stronger or weaker?
They used to say, just try. Yes. Make your teeth strong.
Ideally, those are the bad habits when it comes to your dental health, yeah? Because you can imagine using your teeth, that is causing a lot of trauma to your teeth. And most of the time you find that it actually leads to fracture. Perhaps you might not... you might actually see the trauma at the time and even feel uncomfortable. But in some cases, there might be a thin crack, which you will notice after some time. So ideally, is not a good practice.
Since we're talking about dental hygiene, let's just start with the basics. How do we brush?
Okay, so when it comes to the correct way of brushing, this is a dummy that is simulating the oral cavity, yeah, and we have our brush here. So normally we find that people are always brushing this way, these horizontal strokes. That is not correct, okay? The correct way of brushing is circular motion. Circular motion from the gum through the teeth, down to the teeth and the gum, okay? So you concentrate on one area, like brush like 15 times, take another small area, circular motion, all the way through to this side, okay? So once you do that, you also clean the grinding surfaces of your teeth, and also the inside and the anterior area, same to the upper, and then also clean your tongue. That is the correct way of brushing, and not this, because this one causes wear to the teeth.
Okay, so when it comes to brushing, a lot of trends on social media says that you shouldn't actually wash or rinse your mouth after, because you're actually washing the product out. Is this true?
Well, ideally, you're supposed to brush and spit and not swallow. Yes. In some cases, you can fail to rinse, and of course, some people feel as though that is too much dirt in their mouth. That is why people rinse. But ideally, you are not supposed to rinse, so that the product can actually be absorbed into your teeth.
We're taking a short commercial break, but do not touch that dial. We'll be right back. But before then, take a look at the Did You Know segment. Informative health updates right there, and like we said, we have Dr. Mitch Dotel taking us through dental hygiene. Take a look. So Dr. you've also mentioned flossing. What is flossing, and what product should we use for this practice?
So flossing refers to the practice of cleaning in between your teeth, the areas that you are not able to access while brushing your teeth. And normally we use a dental floss. So we just pass the floss in between teeth to remove the debris that might have packed in between the teeth.
Okay, and
Yes.
this particular dental floss, is there a particular material it should be made of? Because people can take something as simple as a thread and use it for flossing. Is that recommended?
Not at all. The dental floss is made with a very special material that can actually push the debris from in between the teeth. So it is not any floss, specifically the dental floss.
Okay, and there's also a lot of capitalism when it comes to things such as tongue scrapers, mouthwash. Are these things really needed, or we're just being sold to the...
Yes, they are very important, but they are adjuncts to proper oral hygiene practice. Yeah, we're talking of a mouthwash. Yes, the mouthwash is good. I don't refute that, but ideally it should act as an adjunct to a good oral hygiene practice. So you should brush twice a day. You should floss your teeth, and you can use the mouthwash just to help you improve your hygiene more. But ideally, brushing and flossing does the job. Yes, and most of the time, mouthwashes should be on prescription, because there are others that are actually very medicated, which should ideally be given on prescription.
Since we've already talked about the dental hygiene practices, what are some of the common diseases affecting the teeth?
The common diseases affecting the teeth include dental caries, which are just cavities and holes that form on your teeth due to poor oral hygiene. We also have something we call periodontitis. This refers to inflammation of the gums and the supporting tissues of the teeth. We also have halitosis, which is simply bad breath of the mouth. Yes.
So let's start with halitosis. What exactly causes this?
Halitosis can have many causes, can be systemic or can be dental causes. Okay, so when it comes to the dental causes, halitosis can be caused by, number one, the poor oral hygiene. If you're having cavities in your mouth, they could also cause the bad breath, and other systemic issues. Yes.
So if a patient is not necessarily having a dental issue and they have halitosis, should they now start suspecting maybe they have other diseases that are not linked to the teeth?
Normally, if a patient presents with halitosis, we normally first eliminate the most common causes of halitosis. We do the deep cleaning of the mouth and ensure that we have eliminated any cavities in the mouth. Once we have done all that and we have reinforced the good oral hygiene and the halitosis still does not resolve, then we now get deep into finding other causes of halitosis other than dental. Yes, which might be systemic in this case, once the dental issues are sorted.
And what are some of these systemic causes of halitosis?
We have very many systemic causes of halitosis. One of them is hypoglycemia and various liver and kidney diseases.
Okay. So let's go on to dental cavities. Most people actually have cavities. And what is the most common cause of this?
The most common cause of cavities is simply poor oral hygiene, yeah? Because that is what actually causes the dirt to form the holes on your teeth.
Okay. And how do we treat cavities?
Normally, when you come to the dentist, we first investigate and do an x-ray to see the extent of the decay. Yes, once we find that the decay is not very deep, then we can fill the tooth and restore it back to normal structure. And in any case, the cavity is very deep, then we go to what we call root canal treatment, whereby we just remove the nerves and the vessels and rebuild back the tooth so that it is functional but not living.
Okay. And what are the risks associated with root canals?
There are no risks.
Oh, wow. Okay.
There are no risks.
What about... Okay.
Yes.
And no side effects?
Not at all.
Okay. And what is the impact of not getting a root canal or a filling? People just live with their cavity.
Yes, you continue, if one has a cavity and it's not treated, you'll find that the tooth, of course, there will be pain, because once the decay reaches the innermost part of the tooth, which is the pulp that contains the nerves, then it will the patient will experience a lot of pain. And of course, at that point, if they continue, they take their painkillers and just assume the pain might go, but you see the tooth is already dead. Yes, in that case, it will continue breaking, because as the decay eats up the tooth, it reduces the strength also. Yes, when the tooth continues decaying, it breaks. And in some cases, you find that there is no tooth, there are just root stumps remaining in the bone.
Yes. And at what point should a person who has maybe a broken tooth seek medical advice? Is it at that point or when it gets worse?
The earliest, whenever you realize that there is sensitivity or there is a hole on your tooth, that is the point, the best time to see a dentist. The soonest you realize anything that is not right in your mouth, that is the time you need to seek treatment so that it is managed before it is too late.
Okay, and
Yes.
you've also mentioned periodontitis. I don't know if I've mentioned it correctly.
Yes, you've mentioned it correctly.
What is this again?
Yes, periodontitis is the inflammation of the supporting tissues of the tooth. Yes.
Okay, and how does it take place?
It normally occurs when you have poor oral hygiene. Then the bacteria and the dirt, they begin by causing disease process from the gum and going deep into the bone that holds the tooth.
Okay.
Yes.
And what are some of the causes of this other than poor oral hygiene?
Ideally, that is the major etiologic factor.
Okay.
Yes.
What about things such as trauma to the teeth? If someone had an accident, could it cause also?
Not at all. Trauma to the teeth might just fracture the tooth and cannot, that's all it can do.
Okay.
Yes, it does not cause inflammation. The periodontitis is caused by the inflammation itself. Yes, yes, which is majorly due to the plaque accumulation. Poor oral hygiene still.
Okay.
Yes.
And also, we tend to see people not having their canine teeth. I also am one of the victims. Could you also give us some of the reasons why people could be missing a canine tooth or any other tooth?
Normally, there are some teeth that are congenitally missing. So that means they never formed. And it actually happens in a number of our population. Yes, you can find that the permanent tooth never formed. And in some cases, they're there, but they have not gotten enough space to get into the mouth. So they formed, but they are impacted in the bone.
Okay.
Yes.
And is there a way to relieve that? Maybe getting another tooth or actually getting it out, something like that?
Ideally, if it is impacted, we normally check for the favorability. If we are able to bring it down using fixed orthodontics, the braces, yes, then we actually bring it into the mouth. If it is not possible, if it is missing completely, then we go the prosthesis way, trying to find what other replacement options we can do for the missing tooth.
So you also mentioned braces. What are the indications for someone getting braces, or is it just a trend that most adolescents are getting into?
Normally, braces are used for correcting malalignments. Yeah, so you find that perhaps you're not happy with the way your teeth are aligned, then you can go for that option. Yes.
Is there any other indication apart from malalignment?
Not at all. That is the malocclusion is the main indication for braces. Yes.
And what about the people who tend to get double teeth? For example, they need to remove their first tooth and another tooth through above it. What would you recommend for that?
For those cases, normally, in the case where the permanent is already coming into the mouth and the milk tooth is still there, we normally remove the milk tooth because, well, that is an indicator that their time is over in the mouth. Yes, so we remove the milk tooth to give space for the permanent to come into the mouth.
And if this individual is still okay with their milk teeth being present, there's no problem with that?
Not at all. The only time we can leave the milk tooth to remain in place is in cases where the permanent teeth are congenitally missing, they are not there, that is when we can leave the milk teeth. But in cases where the permanent is there, it will actually, it cannot continue growing with the milk tooth. Yes. So it has to be removed for the permanent tooth to continue growing into the mouth. Yes.
Okay, so we also tend to see a lot of people who consume Mira having problems with their teeth. Could you explain why this is?
Well, Mira normally affects the supporting tissues of the teeth, which is the bone and the gum. Yes, so what happens in the early stages, you can never note that there is anything wrong. And then it becomes worse. So when it's very severe is when it is noted. Yes, that is why Mira is never good for the, if at all you want to maintain a good dental health.
Okay, now since we are also talking about oral health, we tend also to see individuals having pimples on their lips, especially when it is cold. I don't know if this is a dental issue also or an oral issue. Could you explain that to us?
At the corners of the mouth, yes, that can be caused by very many causes. Yeah, not exactly dental, but might be systemic, presenting as dental. Yes, in cases of anemia, yes, and herpes, you can note the pimples around the mouth. Yes.
Okay, kindly inform us on the best toothpaste to use, because the market is flooded with so many different, even herbal. Could you tell us, please?
Ideally, I will not mention any in specific, but as long as the toothpaste has fluoride, yes, then you're good to go. The proper fluoride levels.
Okay. And also we have some people who link fluoride to other cognitive function dysfunctions. Could you also comment on that?
Fluoride has its advantages and disadvantages. When it's in the toothpaste, it is advantageous to your teeth because it strengthens your teeth and causes remineralization. Yes, and keeps the teeth stronger. Yes, and also is advantageous for bones.
Okay.
Yes.
Also, could you mention the effect of improper diet on teeth?
Improper diet, we are talking about cariogenic diet. These are diets that can actually aggravate the risk of forming cavities. Yes, so we are just talking about the sugary diet. Yes.
And what about the role of calcium in the diet in supplementing teeth health?
Yes, calcium is important to teeth because once it's absorbed, it contributes to the strength of teeth. Yes.
Okay, so what about individuals who are not able to have a proper diet? Are they at risk of getting teeth diseases?
Ideally, balanced diet is the ideal diet for a good oral health status. Yes. For those who are not able to access proper diet, yes, there might be deficiency. Yes.
Okay.
Yes, the teeth might be brittle, the teeth might be weak.
Okay, and
Yes.
there's also this misconception. I don't know if it's a misconception, maybe you can comment on it, that
Yes.
eating sugarcane, especially when you're younger, tends to strengthen teeth. Is this true?
Yes, eating sugarcane is good because it makes your teeth stronger. It's like gymming your teeth. Yes. So ideally it's good for practicing and making your teeth stronger is good. Yes.
Okay, and what about people who tend to have bleeding gums? What is the cause of this?
Bleeding gums, it still points towards poor oral hygiene. Yes, that is what presents as bleeding gums. Either spontaneously you just bleed or you bleed on brushing. Yes.
And what about pregnant women tend to bleed from the gums? Could you also comment on that?
Ideally, when it comes to bleeding gums, it points towards poor oral hygiene. So if somebody is not maintaining a good oral hygiene, yes, the gums will inflame and they will bleed.
Okay.
Yes.
Do you?
Remedy.
Remedy. Okay. And how can we remedy bleeding gums?
The solution for bleeding gums is number one, good oral hygiene, to change the hygiene practices, and also visit a dentist so that a deep clean is done to restore the health of the gums.
Okay. Could you also tell us what this deep clean is and why can't it be done at home?
Normally, when you come to the dentist, we do the full mouth scaling, whereby we actually clean the pockets, the areas between your gum and your teeth. We remove all the dirt around that area. We clean the interdental spaces and the tongue. Yes, which cannot be done at home, especially in the cases of advanced periodontitis, where we actually have very hard deposits around teeth that cannot be removed at home.
Okay.
Yes.
We also tend to have people who have grooves on their tongue. Could you comment on that?
Yes, that is called geographic tongue. Yes, whereby you find as though the tongue is split. Yes, that is a normal occurrence. Some people in the population have, some people don't have. Yes.
And is it possible to normally just have less than 32 teeth as an adult?
Yes, it is normal because you find that in some cases, some teeth are congenitally missing. It means that from birth, they never formed, which is still okay as long as the patient or the person has enough teeth for function and aesthetics. It's very much okay.
So also give us your parting shots in relation to dental hygiene.
Well, my parting shot is a happy mouth is a happy body. A healthy mouth is a healthy body. Remember to brush your mouth, brush your teeth 2 times in a day, circular motion, and make sure that you floss as well. And see the dentist for your 2 times in a year for your visits. Thank you.
Very informative conversation we've just had, and just as Dr. Mitch has emphasized, make sure you visit your dentist up to 2 times a year. I have been your host, Joy Bofenda, and until next time, stay safe, stay healthy, and live with a healthy you segment.